All right. So guys, I'm here with Mona and we're here to work on her back and hips. Mona, you want to talk a little bit about what's going on with you, what you're dealing with?
Yeah, so
Yeah.
about a year ago, I had some pain in my hips, and it came from I think my coccyx, and it went up to my lower back, and then it happens at my upper legs and hamstrings sides actually become very heavy and like muscle pain, and then it feels like I'm unable to walk, and then I feel like I need to vomit. That's when it happens like really strongly. Now it's less, but I feel like dizzy, vomiting, and then I cannot even sit down because it's like I'm gonna fall. And then what happened is I just hold on to somebody, and I kind of like burst into tears, and then the pain releases after 1 minute, 2 minutes, maybe longer, and then I can walk again, but with very like heavy
With
legs.
limited mobility.
Yeah, now it's better.
Yeah.
But
And it happens like you're in a certain situation, maybe having a certain thing going on in your environment.
well, I think it's when it happened a lot of times when I was living here and I went to San Marcos and I was carrying my backpack with sometimes a lot of stuff, and I already have all my life lower back pain, so I'm not so strong at that moment, and I don't know. I took some weight, and then after it happens, also because maybe I'm triggered there.
Triggered.
Yeah, by a lot of emotions, things happening around me.
Cool.
Yeah.
All right, go ahead and lay down on your back.
Mhm.
So guys, this happens for a few reasons, these kinds of flare-ups. This is a neurological inflammation that she's experiencing. And it can happen because of instability down, I guess the adductor longus, the inside of the thighs, and also the lower abdomen. But it can also happen because of emotional reasons. Something in the environment triggers this. Because when I was talking to her earlier, she was sharing how this just kind of happens spontaneously. It's not something that's like perpetual and chronic. It it is chronic, and it's in the fact that it is continuously happening, but it's not happening all the time, all day long. So there's certain things that are flaring up her lower back, her hips, and it's so funny that we just did that hamstring video because that's exactly where I'm going to start, right? Whenever I do therapy, I always start with mobility. I check the person's range of motion and see where it's compromised. See, obviously here, there's a little bit of tension I'm feeling down her coccyx. You feel that too?
Yeah, actually.
Oh, you feel that? Oh, you feel that more in there. Okay, she's having a little bit of a pinch in the front of her leg. So that happens to certain people, and what we do is just kind of make more space there. Okay, is that better?
Mhm.
What I'm doing is I'm externally rotating and lifting up here, so that when I press down, there's more space on the inside of her hips. So we start with some hip mobility, hamstring stretching. And like I said, I think this is the most important thing that we can do when we stretch is get those hamstrings stretching. Because, like I shared in the video this morning, it's stretching the whole back, but one thing I forgot to add was that it also creates a level of connection that the body does not get to experience most of the time. And that is the connection to the legs, from the legs to the chest, to the belly. When else do you experience that? In the fetal position, first 9 months of life, you have that connection. And when you really focus, like when you're really holding your legs into your chest, you can feel your stomach. You can feel your heartbeat. And it really connects you back to your body. And it's a great way to get out of that fight or flight response in a very subtle way. So that's what we start with, doing a little bit of range of motion. Now we're just doing a quick demo here, so I won't be doing too much. But I'm going to show you in a second what we're going to do to release the neurological response, that fight or flight response, that overactivity she's getting in her hips. Oh, we had a nice pop there. Um, honestly, guys, I find proper stretching and using proper resistance stretching is a great way to get almost the same results you would with a chiropractor. Chiropractors are not popping your bones. In fact, if you go to a good chiropractor, they will be insulted if you say that they pop your bones. What's happening is they're increasing mobility in your joints. Your joints aren't meant to stay one certain way forever. It's not like you're in perfect alignment and that's how you're supposed to be forever. Otherwise, you'd walk around like a stick. The whole idea of being healthy is having proper mobility, having that access to the full range of motion, and having good circulation to the body. In this case with the bones, synovial fluid, but in the grand scheme of things, good circulation. The blood is carrying everything. Okay. Now when I stretch her, she's doing a great job breathing, by the way. I haven't had to say anything about that. But when I'm stretching her, I'm taking her to the limit of her range of motion, her healthy limit. Okay? And that's found when I'm stretching her and there's just a light amount of resistance coming back. Her body is pushing back, and that's how I know she's feeling a deep stretch. Now the trick is to keep that pressure through the entire range of motion. If you lose it, you lose the stretch. If you lose it, you lose the connection. Earlier today, I was talking about how when you feel that strong stretch, it's almost like a jolt of electricity going through your body. But isn't it beautiful? You're feeling a strong connection from one part of your body to the next that you would not otherwise feel. And that only happens when we stimulate the body, when we go to that end of range of motion. And especially when we start doing things like resistance stretching, which we're going to do in just a bit. What's happening with the flare-up she just talked about is that she's overactive in the... Oof, you okay?
Yeah.
What happened?
It just shifted here.
Just shifted?
Yeah, like
Okay.
click.
All right, so obviously she has some instability in her lower hips, okay? And what's happening is she's overactive in the outside of her glutes and her TFL, all right? So lateral glute and TFL. So what happens is when she's doing things like holding a backpack and she's, her body's just had enough, it'll flare up and she'll start spazzing in those areas. That's when you get locked up, and honestly the nervous system gets a little burnt out. That's why she was saying, she's feeling a slight level of paralysis after, because the nervous system is fried. It doesn't want to work anymore. So what do we have to do? First, we have to release that tension. That's why you see I've been rotating her hips, and even when I'm doing the hamstring stretch, I'm bringing it out this way a little bit so that she gets a stretch on the outside of her glute even. Okay? Now, once we've done that, what we want to do is two things. We want to first, I'm going to engage her whole hamstring complex with a resistance stretch, and then we're going to check to retrain the overactivity here and train in the underactivity over here. Okay, so why is this flaring up? Because this is not doing its job. The inside of the thigh and the core needs to be stabilized. So we're going to do a few exercises for that. The first one, always I like to start with the hamstrings, guys. It's just like, it's the mother of all stretches, in my opinion. Okay, gonna put some stability here so she doesn't go out. Okay, then I'm gonna apply some pressure downward so she makes that chest to thigh connection. Now she's stable, she doesn't have to worry. All she has to do is push back. So what we're gonna do in a second, I want you to bring your toes towards you. Okay, and push your heel into my hand. Push it down towards your butt. There you go. Okay, so we're gonna start here. I'm gonna recenter her. Push. Good. Okay, and as I come up, I can start applying pressure this way. Breathe. So she's gonna freak out. This is not even close to her end of range of motion, but she's already feeling it because there's trauma stored there. Whether it's emotional or physiological, it doesn't matter. It needs to go. Okay, breathe. For 5, push as hard as you can. 4, 3, 2. Now look, she can go. Look how far she can go already. But we had to stop here because the trauma response is stored right there in that range of motion. So we're gonna try again. Okay, go. Breathe. We're gonna work through right here. This is where it gets challenging for her. Breathe. Get through it. Get through it. Look. Okay, we had a pop, like an adjustment just now. Okay, push, push, push. This is almost your end of range of motion for 5, 4, breathe. Keep going. 2, 1, relax. Just to give her some relief, I'm going to just create a little leg extension here. We'll do the same thing on this side. Toes towards you, push down. If you want to, you can bring your hands here to bring your chest into your thigh. Or yeah, bring your thigh into your chest. Here we go. Breathe for 5, 4, 3, 2, 1. I won't push it too much. It's only your first time on this side. Okay?
When you did that, this was like
Tingling?
nerve, yeah, something here.
That's good.
Okay.
See, look what happens, guys. Because we're stretching the whole hamstring complex, wherever it's compromised, wherever the flow of electricity in the nervous system is compromised, that's where she starts feeling it again. Because we're rushing that circulation through the whole kinetic chain, not just one part. This is the benefit of bringing that chest to thigh connection when you do the hamstring strip. Toes towards you. Push. Breathe through it. You've already done it. Let's go past because it gets easier. It gets easier right here. Stay with me though. 3, 2, 1. Why is she yelling? Look, that's her normal range of motion. We're not hurting her, okay? But there's trauma there. That's why people have these responses, whether it's yelling, crying, screaming, whatever it is. Laughing, can be many things. Let's do one more on this side. I'm just feeling like I feel like you're, yeah. You feel more on this side, yeah?
A lot of tension.
Yeah, push. Now guys, when you do this kind of body work, push. When you do this kind of body work, you can start feeling where people have tension. It's just, you feel for where they're resisting back and how it's feeling when they resist. It's something you develop over time. Keep going, you're doing great. Breathe, breathe, breathe. 5, 4, 3, 2, excellent. Okay? And you gotta know where to stop with people. Once you start feeling too much pushback, even if it's not the end of range, stop. They're processing something there. Yeah? All right, so now that we've opened up the hamstrings, how are your hips feeling already? Lower back, hips?
This is like intense feeling.
Intense
here,
feeling?
Like, yeah,
Good?
yeah, but for the rest, it's okay.
Are you feeling more sensation on the inside?
No, more here. This.
I know, but are you able to feel, not where you're feeling it more,
okay.
but are you able to feel more things down the inside of your leg as well? I guess that's a hard question to answer. But what she just said right here about she's feeling it hard on the outside, that's a good thing. What we want to do is tire out those muscles. No amount of massage is going to tire out the muscle. That's the only way we stop the nervous system from firing the way it's been firing. We control the range of motion so she's stable, so she doesn't have that seize up. All right, she doesn't seize up. But we're also tiring this out. What happens when we tire it out? It can't work as hard. The body can't compensate anymore. It has to use the proper muscles. So what we're gonna do now is I'm gonna have you bring your feet together, okay? Push into my forearms, push. Keep your lower back down, engage your core, good. 5, 4, 3, 2, 1. Good, we're gonna do that a couple more times. If we had more time, we'd do it a lot more times. But the goal is to exhaust the outside, to tire it out, so that when we do it the other way, when we start using these muscles, she's gonna start firing properly. Go, push. Five, 4, 3, 2, 1, good. One more, engage your core a little bit more, keep your lower back flat. Flat, there you go, good. Push. Good. A little bit more here. Push. 3, 2, good. Relax. Okay. Now we're gonna do it the other way. She's tired. You're tired, aren't you?
No, I'm okay.
You're okay?
I'm good, yeah.
Go one more time. I'm gonna wear you out. Push. Push as hard as you can. Push, push, push. As hard as you can. As hard as you can. When you got people that won't tire out, it's not about how many reps. Just go really slow on the rep. Make them really push. 3. Seeing a compensation pattern coming up. When they get tired, you start seeing where they compensate. Her hip is shifting. The right hip is coming up. Oof, you okay? Now you tired, huh? Good. You start seeing more things when people get tired. But it's good, okay? Watch what we're gonna do now. Now I'm controlling the whole range, okay? I can feel these subtle things because I can see where she's wanting to shift, but for the most part, I'm keeping her as stable as I possibly can. I'm controlling the entire range. Okay, push. And you'll see how I use my shins and my feet, and maybe not even just this exercise, but in other ones. Hold on, I'm gonna switch my position for a second. Squeeze. Okay, I'm gonna have to adjust these knees. The right one's, the left one's coming up, so let's just adjust there. Okay, and now I get to the side and start bringing the legs apart. Okay, that's just to create more space. It's better for my leverage. And then when I get here, I can bring the knees on the inside. Keep pushing. Okay, and you just use my body weight from this point. It's not so hard. Push, push. 5, 4, 3. Push as hard as you can for 3. Push, push, push. 2, 1. Relax. We're gonna do that one more time. Squeeze. To the side. Push. And then to the front. 5, 4, 3, 2, 1. Let's go a little bit further. She has some more range. I'm not feeling enough pushback yet. 3, 2, good. Last one. Look what I'm going to do here. Okay, it's pretty much the same exercise, but now we're bringing them down, the knees down as well. So bring your knees together, knees together, knees together. I'm going to get to the side. Go. Okay, so keep your knees up to your chest. So watch. As we're bringing the legs apart, we're also going to start bringing them down. Push, push, push. Push, push, push. Three, 2, 1. Okay. Last thing I'll do here is just get some lower abdomen engagement. So what we've done is we've tired out the outside. We've activated the inside. There were some muscles that just weren't firing properly. And now they are. Okay. Now, last thing we're gonna do, bring your knee up here, toes up. This engages the lower abdomen and the top of the thighs. Here we go. Lift your knee up. This way.
What did you say?
So keep your knee here.
Oh, okay.
Yeah. Toes towards you.
Mm-hmm.
Go. Also create some length in the ball and socket. See, okay, she's compromised there. Push. Push. Right here. Push. Stay with it. Stay with it. Don't give up. Right here. Right here. Stay with it for 5, 4. Come on. 3, 2, 1. Ooh, there we go. You can see exactly where she gives in. And that shows exactly what I was saying. There's instability in the front of the body and in the lower abdomen and the hips that's causing the outside to overwork. Because she didn't give in when we did that first exercise. She said, I'm not tired, because the outside of her legs are used to working. So we have to wear them out by going slowly, taking our time in that rep. Toes towards you. Go. Three, 2, stay with me, you got a little bit more. 3, 2, 1. When you're doing this on someone, guys, be really mindful. Do not press around their knee. You know, just a little bit higher. You don't want to create any pain or destabilize their knee. Go. Three. Go, go, go. 3, 2, 1. And when I'm pushing down, I'm also doing like a slight internal rotation because I noticed she likes to compensate. If you can see her toes, I don't know if you can see her toes, but they're like pointing out. That shows that she's overactive here, underactive here. So when I bring the knee down like that, it's gonna have a tendency to go outward too. So I need to control that by pushing down with an inward rotation. Well, I hope that helped. Let's see, let's check in with her in a day or two and see if we had any benefits. Thanks for watching, guys.